Hello, everyone. My name is Andrew Pucker, and I'm here with another installment of the American Academy of Optometry Foundation's clinical podcast series. I'm the Senior Director of Clinical Medical Sciences at Lexitas Pharma Services. I'm also a fellow and diplomated of the Academy. And today I'm here with Patrick Vollmer, an expert related to Demodex blepharitis. Patrick, could you please tell us a little bit about you and how you got involved in this research?
Thank you, Andrew, for having me on. My name is Patrick Vollmer. I have a private practice clinic about 45 minutes outside of Charlotte, North Carolina. And I was recruited for the Tarsus trials, both the Saturn-1 and Saturn-2, through my previous research experience doing clinical research with other ophthalmic companies.
That's great. We need more people like you in the world just doing the hard work.
Thank you.
So today we're going to discuss actually the first Saturn trial, so Saturn-1. Could you give us a little background on Demodex blepharitis and why we should care about it?
Andrew, the purpose of the study was to evaluate the safety and efficacy of XDEMVY compared with vehicle for the treatment of Demodex blepharitis. And really, Andrew, until last month, Demodex blepharitis had this massive clinical implication, and there was no FDA cures available, no FDA-approved cures available. It is important to remember that Demodex mites are part of the normal skin flora, and they're the most common ectoparasite found in humans. So we can kind of break down Demodex blepharitis into two species of mites. There's the folliculorum and then the Demodex brevis. So the folliculorum is what colonizes the base of the eyelash, while the brevis can actually be found anywhere within the meibomian glands.
That's awesome. Yeah, and I guess just August of 2023, we now have an FDA-approved drug for Demodex blepharitis, which I think that could be a game changer. So this study used an interesting method for just determining if patients have Demodex blepharitis. Could you maybe describe that so people could apply that to their clinical day and maybe find these patients and treat them with XDEMVY?
Tarsus, for the study, they used the Collarette grading scale, and we can really apply that to clinical care, even in our own offices. But the grading scales for counting the mites in the Saturn-1 and the Saturn-2 trials were actually identical. So as an investigator, we looked at the upper and lower lids, and we graded the upper and lower lids in the following manner, just based on Demodex prevalence. So it was grade 0 through 4. If there was grade 0, that means only 0 to 2 lashes were infected on the lid margin, so almost nothing. Grade 1 was when we saw 3 to 10 lashes infected on the upper or lower lid margins. And then grade 2 was 10 to about a third of the lashes were infected. And grade 2 is what you needed to be able to get into the study. So if you had less than a grade 2, you did not qualify for the study. You were just, you couldn't do it. Grade 3 was when we hit a third to 2/3 the lashes were infected. And then grade 4, which is the highest that we saw, was 2/3 or greater lashes that were infected with Demodex blepharitis. And this is why it's crucial to have the patient look down and then up as we grade them, rather than have the patient just look straight ahead in primary gaze, where infestation can be easily missed.
I really like that grading scale. Historically, if you look at the literature, you used to have to pull the eyelashes out and then count the mites. And like, what patient actually wants to do that? And as the doctor, you don't want to hurt your patient by ripping out pieces of hair, right?
I
So
got pretty good.
you bet you got good at that because I'm sure you did some of that with these studies too. But
Right.
like I think the papers say that mite count and the cholerae count is super highly correlated, so you can just probably go with the easier one.
That's
So
right. One of the important things to remember is, it's even easier to diagnose than dry eye. I mean, at least with dry eye, hopefully people use, fluorescein strip or something. With this, all you need is a slit lamp, and any presence of collarettes on the upper or lower lid margins is 100% indicative of the presence of Demodex blepharitis.
I love it. It's the pathognomonic sign, right?
Absolutely.
So since this is a new treatment, how do we prescribe this? Like what's the dosing, the duration, that sort of thing?
So XDEMVY in the clinical trials, and now that we can prescribe it clinically to our patients, It was dosed twice a day for 6 weeks, and then one of the endpoints of the study, after 6 weeks, all the primary and secondary endpoints were met, and that basically encompasses a complete collaret cure, a clinically meaningful collaret cure, mite eradication, and then redness cure and a redness response. Furthermore, it's important to note that the proportion of patients who achieved a redness score, which is like grade 0 redness at day 43, was much higher in the study group compared with the control group.
That's amazing. So kind of going with that, how long before you can really see a response with these subjects? So you put them on a drop. Do you have to wait weeks or how does that work?
So as we actually saw a statistical significant response as little as day 15, which is the second follow-up after baseline. So 2 weeks.
That's pretty quick. It's better than dry eye, right?
Yeah, much better.
And then, patients are taking these drops. What do they think of them? Do they burn or what's going to?
Actually, no. So we do a lot of studies. I do a lot of studies where, we see a lot of the drops that really do burn or are uncomfortable for the patient. One of the good things about this was that it was very well tolerated, XDEMVY, and with a safety profile that was very similar to the vehicle. All of the related adverse events were mild, and there was no treatment-related discontinuations from the study. About 90% of patients reported the drop to be either neutral or very comfortable, and there's no significant findings across several safety assessments at the end of the study.
So basically no downsides, treat them and they get better and they like the drop.
That's right. A lot of my patients, they always, kind of tell me, oh, like the drop or whatever. And everyone said the drop was fine. I didn't have anybody report any stinging in any of the groups that I did. So,
Well, that's great. And that's great work. Before we leave, do you have any closing thoughts you want to leave our listeners with?
well, really just the conclusion of the study was really, and my own conclusions was just BID dosing of XDEMVY for 43 days is a very safe and effective means of getting rid of Demodex Blepharitis. And, I'm really excited to prescribe it personally in my clinic.
That's awesome. Well, thank you for being with us today, Patrick. And I'd like to thank the listeners for tuning in. And I hope to see you again soon.
Thanks, Andrew.